He broke his spine at T10, T11, T12 level. There's nothing pretty much that could be done for him to regain any functions, walking or anything. I wasn't coming here set in my mind that he will be where he is today, not even at the slightest. And I mean, to see him standing and taking steps, if I was to make that decision again, it would be the same. Yes. So my name's Kamila. I'm Alan's mom. Alan's a patient at Verita Neuro. We are Polish, but we live in UK, England. Alan got his injury in December 2023, so we are 9 months post-injury. He broke his spine at T10, T11, T12 level, but I think the most spinal cord injury is around T10, T11. So that's where it is. So he's paralyzed from just below the waist down. According to his neurologist back in the UK, his injury is complete Asia A, which means it's just complete. That's done. There's nothing pretty much that could be done for him to regain any functions, walking or anything. That's him done. That's what we were told 9 months ago. So what we've done, we have found a private place in Poland for neuro rehab, like in the first phase after his accident, just to get him back to kind of some strength and build his muscle back a bit and basically get him healthy. But he hasn't had any treatment as such to improve or to change his condition apart from rehab. He was a gym goer before the accident. He was really active. But then obviously he lost about 10 kilograms weight, all around the surgery and injury. Now he regained that back plus more. So he's kind of like, I can tell now, even looking at his face, that, is back like to himself, healthy, happy Alan. Yeah. My husband actually was looking around online on different groups, forums, different Facebook and anything really. And he came across your ex-patient actually, a young man from Poland. So my husband approached him and did ask what treatment he had. So he said that he actually has been in Bangkok and but he has not had the stimulator back then, because we're talking many years ago, but he still recommended you. Then I came into action, put your name into the engine search online and just started looking, reading about, and just took it from there. But yeah, we found you actually through a recommendation of your ex-patient from many years ago. So it was actually after the consultation we had with Dr. Nasir over Zoom or Teams. Anyway, it was online consultation with me and Alan present. It was about an hour long, really. So it was all in-depth consultation, and Dr. Nasir answered all of our questions, went through Alan's MRI pictures with us on the screen, explained everything. And after that, before I even ended the call, I knew that we'll be going. I just needed to run it past Alan if he agrees, because obviously he's in the age where, I can't exclude him from decision making. But yeah, it was like 99% going, and then I just needed his 1% input just to have 100. But yeah, I think just having a chat with Dr. Nasir or any medical staff from Verita Neuro was like getting me closer to making the decision. Because I mean, you can read anything on the internet. There are always pros and cons. There are always people that will support these things. Others will say, well, it's an experiment. There are different factors, but yeah, after speaking to Dr. Nasir, we were like, yeah, he seems to know what he's talking about. So yeah. I'd give it a week when everything settled and Alan kind of got into grips with it, how it works, and the exercise and mapping process. Obviously, we could see his moving legs 2 days after, I think, because his first mapping session was on Tuesday and he had surgery on Sunday. So 2 days. But like a proper result for me, I think I'd say a week. And I could see that actually he is like knowing what he's doing. Yeah, he just got around these things and thinking, oh yeah, I know what they want from me and how it works. So I would say a week to be on the safe side. Yeah. Yeah. Well, he's taking steps with Zimmer frame with Walker. That's it. There's a lot of things. The main one is taking steps with the walker or with the parallel bars, which is like amazing. Minimal support from his therapist. He can stand without the braces, without a lot of support. He also have a great bowel program with the stimulator now, so his morning routine takes 10-15 minutes rather than 30-45. Yeah, I mean, again, there's a spasm program. So when he gets out of bed in the morning, put that on so his legs aren't stiff anymore. He's more flexible. Dressing, showering is a lot easier. So, I mean, there's a lot I could talk about, but the main one I think is when I saw him yesterday confidently stepping with the walker or using the bars. Yeah. And just his strength and his muscle tone in his legs, absolutely. And from what the therapist said as well, now I'm back in 4 or 5 weeks. Yeah. I was hopeful, don't get me wrong, but on the other side, I was thinking realistically, no miracle's gonna happen in 4 weeks. It's not a cure. It's just another treatment, another thing to try out and see if it's going to help. So we came, a lot of people were excited, our friends, family saying, oh, so does that mean he's going to walk again? And I always said, no, we're not going there with the aim for Alan to come back walking on his feet. We're just going for any slightest improvement. Anything is a bonus to us. And I mean, to see him standing and taking steps. Yeah, but I wasn't coming here set in my mind that he will be where he is today. Not even at the slightest. Yeah. Absolutely amazing people. Starting from the therapist, ending up at Dr. Nasir, neurosurgeon, customer service. Every single person have been just absolutely amazing. Full of knowledge, helpful, polite, kind, happy, but still professional. There wasn't a thing that they wouldn't do for us or help us with, like for an instance, we needed a consultation with a different doctor, different area of medicine. That was arranged for us in no time, no problem. Yeah, absolutely brilliant. Yeah. The one thing that I've learned, how anyone can tell you if you will walk or you not walk, nobody knows that. So don't give up. Don't close down because a doctor told you you're not going to walk again. They don't know that. What's, written down, whatever, if you complete, incomplete, whatever stage, whatever grade, doesn't matter. It's you as a person. It's your body. You know best. Go for it, research and do something. Don't sit, don't get wasted in that wheelchair, because that can happen so easily and so quickly. Looking at Alan, how the wastage of his muscles, and his strength in lower body within 9 months, it was rapid. So don't give up. Research, and if you haven't got the funds, you haven't got the resources, just do something at home, like we did with Alan for 8 months. We've exercised every day, we've practiced every day. We would take him swimming, he would go to the gym, with stretches, standing every day. Just go for it. Just don't give up on yourself. And if you can, come here and give yourself a chance. Absolutely. Yeah. But never give up, ever.